Good afternoon, everyone. Welcome to today's Behavioral Health Stakeholder webinar with the Arkansas Department of Human Services. This webinar is brought to you by AFMC, and we will be discussing the licensure and certification process for OBH, the transition plan, and new services. Please note that some of the slides may be familiar, but there is a lot of new information, so we do encourage you to stay on until the end of the presentation. Before we get started, I'd like to go over a few logistics. To eliminate background noise, phone lines are being muted during today's event. Questions may be submitted through the online Q&A section located to the right of your screen, and we will answer questions at the end of the session. Today's event will be recorded and posted to the AFMC website. Once posted, all attendees will receive an email, including a link to today's recording. I'm now going to turn the presentation over to Craig Cloud, the Director of the Division of Provider Services and Quality Assurance, to open the webinar. Craig?
All righty. Thank you so much, Cheryl. It's good to be with you all today. And again, excuse me, I appreciate you all joining us on a regular basis so that the Department of Human Services can provide updates to each of you on our new OBH program, transition from RSPMI to OBH, as well as answer any questions that you might have. Very quickly, I want to be able to cover from a high level two topics that are somewhat important to each of you, the providers, as well as us at DHS. One surrounds rendering provider status and some specific identifiers, MPI, and other credentials, if I can use that word, that providers must have to bill. Before we make these requirement which we have to move forward with this, we want to make sure that we're allowing sufficient time for us to work with the provider community on ensuring that each of you comply and that there's no delay in your ability to provide services, nor understanding what steps you, the provider, must take to comply with those requirements for billing. I expect us to cover these requirements in greater detail in subsequent webinars, which we will now have on a weekly basis for the next several weeks to make sure that we're providing an adequate amount of information to you, the provider, as we transition over to the new OBH model and the OBH program. I know that many of you have already started working on your NPI and other steps necessary for rendering provider. If you're on the phone and you started moving in that direction, you started taking the steps necessary, do not pause. Continue to do so. Continue to move forward. But for those providers that have not, or that may continue to have questions about how to accomplish this, we want to work with you to make sure that you have access to the information. So I fully expect us to begin covering this sometime over the next couple of weeks. Trish Gann and Sherry Crawford are here, and we will discuss specifically how we want to engage and share this information to the providers. We'll also include our partners, AFMC, as well as DXC, in this discussion. So again, I wanted to put that out there. We don't want anyone in the provider community to be concerned or to be alarmed about this upcoming change, and we're committed to working with you in a timely manner to make sure that you meet these requirements. All right, next is very quickly on the transition from RSPMI to OBH. Many of you know that we will grandfather existing RSPMI providers for the Tier 1 services and those other Tier 2 that fall that you are already providing under RSPMI. Obviously, if you choose to specialize and provide partial hospitalization, therapeutic communities, and others, we must have an application. We must have an application to consider the certification of you providing those services. But your existing services will be grandfathered over into OBH. However, you must still submit to the Division of Provider Services and Quality Assurance, and Sherry Crawford is here today, in writing with a 30-day notice, your intent to transition. And as we've announced and stated in previous trainings, we are wanting and requiring a 30-day notice to do so, to allow our staff an adequate amount of time to review your intent, the transition, the grandfather, and ensure that that transition can happen as smoothly as possible. So I say that to move forward. Today is May the 24th. June the 1st is a week from Friday. And with the 30-day requirement, that means that if you intend to transition to OBH and to grandfather over, then we need your letter and your intent to us by June the 1st. The Department of Human Services will be transitioning to OBH effective July 1st of this year. And that has been, as we've communicated, and has been promulgated and has been approved. Effective July 1st, 2018, all RSPMI providers shall transition to OBH or lose your ability to bill Medicaid. So again, to ensure that no consumer, no beneficiary has a delay or potential problem in assessing services under the new model, I encourage you to ensure that you submit those intents to us by June the 1st. We will also be reaching out to these providers that we've not received the intents from, either by email, letter, phone calls, and all methods of communication to remind you of your intent to do so, and the requirement that we need your letter and your intent to us by June the 1st, which is 1 week from Friday, to ensure no delay in services or the transition to OBH for your program or for the beneficiaries that you serve. I wanted to cover each of those areas from a high level. Again, I plan to attend these weekly webinars as much as possible over the next several weeks to make sure that we answer your questions, provide you information, and ensure that we're working collectively with you, the provider, on this transition and making this transition as smooth as possible. I appreciate you all joining us today. As Cheryl said, it's very important. Some of the areas that we'll cover the first part of the session is information that we have covered previously. However, we want to make sure that every provider has access and has shared that information. But there's also important information that will be shared during the course of the training today that may be new to some of you, and I encourage you to stay on the line and to listen to the full length of the presentation today. Also, AFMC, our partner in conducting these webinars, and I appreciate their assistance, will be providing a list to me of all attendees as well as the provider that they represent. And if those providers are on the phone today and we have not yet received your intent, I consider this as a notice to you that we are requiring and expecting your letter and your intent no later than next Friday, June the 1st. Again, it's very important to ensure that we receive this, to ensure a timely and effective transition over to OBH by July 1st of 2018. Again, appreciate you all being here today and look forward to visiting with you all in the future. Don't hesitate to call or email me if you have any specific questions. Thank you.
Thank you very much. We're going to now turn the presentation over to Sherry Proffer with the Department of Licensure and Certification to discuss the OBH certification. Sherry?
Thank you, Cheryl, and good afternoon, everyone. So, like Craig said, we're going to talk about the transition process from RSPMI to the OBH. And like Craig said, effective July 1st, all RSPMI providers shall transition over to OBHS or lose their ability to bill Medicaid. The Division of Provider Services and Quality Assurance has the responsibility of the licensure and certification of all RSPMI providers grandfathering into OBHS. The current RSPMI provider shall notify our office of their intent to transfer and the transfer date. What I want to say here is that when you put your intent on there, since we're getting so close, we would prefer that you put the actual date so we can notify Beacon and Medicaid so they can start those numbers rolling. Like we did last week, we're going to start off with some questions that have been previously asked from previous. You decide and request additional certifications after you become an OBHS or BHA. Yes, if you decide you want to obtain additional certifications for partial hospitalization, therapeutic community level 1 or level 2, and might add that if you want to be a TC, please indicate on the form whether or not you want to be a level 1 or a level 2, because they have different staffing ratios, different criterion that you have to meet, etc. Acute crisis unit, substance abuse treatment center, or community reintegration. You may do so. You have to complete the form, which we'll go over the form later on in the presentation. We will then conduct a site visit on these new certifications to ensure compliance with the specific certification requirements. And if approved, a certification will be mailed to the BHA. If you are certified by the Joint Commission, does the DISQUEST certification run until the recertification date of the Joint Commission? Yes, currently, now I've had several questions on this, and I'm going to answer this. Yes, currently the license you receive as a BHA will have the expiration date as your certification or other accreditation agency. However, the office is knowledgeable about the 6-month extension, and we are keeping that 6-month extension open in our office. However, your certification will have the end date or the expiration date of your accreditation agency date. So I hope that is clear. The license will have the same, your BHA license will have the same expiration date as your accreditation agency. However, our office is aware of the 6 months that you have to obtain your paperwork from the accreditation agency. I just wanted to let you all know that we know that, and that, but the expiration dates have to be the same. Do we need to turn in a form for each site and each program we have? Yes, our office is requesting that each site fill out a transition form. We have each site listed separately, and each licensure survey will be conducted on a site-by-site basis instead of the main program site. So in this case, individual records will need to be kept at each individually licensed and certified site instead of the main office. I've received numerous questions about the personnel records. And the personnel records, this is a way to, since we've identified and we're licensing site by site, we're requiring that the employees, and there are some there are some regulations that we have in the BHA that I have addressed with some of you via email. However, the personnel records, we would like them at the site that we are going to be currently surveying, instead of going to the main site to look at personnel records and then drive all over the state for all your other site licenses. If you have electronic records, we will be able, and we have the ability to obtain those electronic records through a laptop, and, then that will be fine. If not, the facility can have a dummy file. And in that dummy file, they can have a main personnel record in their main site, however, at the BHA site. But if you have other sites that you're providing services at that we're giving additional licenses to, your personnel records have to include job descriptions, everything that's in your regulations, job descriptions, current licenses, criminal record checks, employee clearance registry checks, all those articles. We do not need to see personnel records. We do not need to verify Social Security numbers. We do not need to verify any of those things that we don't need to see, but we do need to see such items as their application. Have you conducted reference checks? Do they have the criminal background checks? Where is their job description, like I said previously? So those items shall be at the site that we have licensed. And if you still have any questions, go ahead and put them in your question box, and we can get to them later, or I can get to them later on during the week. Are substance abuse certification regs available yet? Yes, the substance abuse certification regulations can be downloaded at, and there is your download site. It's http://humanservices.arkansas.gov about-DHS/DBHS/publications. And all of the regs there, in fact, you can get your OBHS regulations, the Medicaid manual there. You can get all of your additional certification manuals and regulations there. They're all at this site. If we are already licensed to provide substance abuse services, will a site visit still need to occur? No. If you're already licensed as a provider for substance abuse, the site visit will not be required. However, if the currently licensed substance abuse provider wants to bill Medicaid and they're currently not an RSPMI, then the substance abuse provider shall first become a licensed BHA, and then they will be certified to provide substance abuse services if that is checked on the form. Excuse me. So, if you are currently a substance abuse provider and not an RSPMI, and you want to bill Medicaid, you will need to become a behavioral health agency first. And you can fill out a new application for a BHA, and then check substance abuse, and then we'll come out there, do a site visit. Oh, well, site visit won't be required. Apologize for that. And then we can go ahead and send you a license for a BHA and certify you for a substance abuse provider. If you are not going to bill Medicaid, then nothing changes. If you're currently licensed as a substance abuse provider and you are not, and you're going to be private pay or take private insurance, then you do not have to become a BHA. And that just came on to question number 6. I just answered that one. Who at the Division of Provider Services Quality Assurance does the agency notify? Please complete your transition form and send it to Cindy Corbett at cynthia.corbett@dhs.arkansas.gov, or you may call her at 501-320-6415. And if you need copies of the regulations, any of them for partial hospitalization, OBHS, BHA, so on and so forth, Cindy can email those to you if you have problems getting into the website, Division of Behavioral Health's website. Excuse me. We will be an OBH program, so if we have independently licensed professional that is a contractor with us, they cannot bill Medicaid, correct? Yes, correct. If the BHA contracts with an ILP, the Behavioral Health Agency bills Medicaid and then pays the contracted independent licensed practitioner their negotiated contracted price, as the ILP excuse me, is working for the BHA in this instance, not for themselves. We have several, I hope that is clear. BHAs have all the staff that they have. I mean, they can bill for Tier 1 services with their current staff if they're an RSPMI. But ILPs, the purpose for ILPs is for them to be independent, hold their own office, have clients come in there, and then they can bill Medicaid for those services that they provide. Here's another question on ILPs. We have several ILPs that have their offices in adjacent cities to BHA. Can they contract with our agency to provide services and provide them at their location with the agency billing for the service, or can we open a satellite office at their location? Okay. If the ILP, and I'm going to say this again, contracts with the Behavioral Health Agency, the ILP may provide services at our office's certified ILP site. Remember, each ILP site has to be certified by our office. And then the Behavioral Health Agency bills Medicaid and then pays the contracted ILP. If the BHA wants a satellite office, the office shall be licensed by DIPSCLA, and the BHA provides the Tier 1 service and bills Medicaid. I'm not sure this person understands the question, and maybe they do, and maybe I just don't get it. But BHAs, like I said before, can provide Tier 1 level services. The ILPs, they should have their QBHPs, or used to be LACs. Those, they can provide those Tier 1 level services within the BHA. So I'm not sure why a BHA would want to contract with an ILP unless they didn't have any LSWs. LMSW.
LCSW.
LCSW. Thank you, Trish.
You're welcome.
She always knows those better than I. Can one individual own a company with many ILPs working all over the state? The intent of ILPs is so they can work independently in their own certified office and keep their own records there in a locked, safe environment and provide services to their clients in a private office. It is not the intent for a broker to keep one office and have ILPs work all over the state. ILPs have to have an individual office that is certified by our office and that they work out of. ILPs cannot work out of their car. I think Craig made this next point pretty clear. Do we have to flip by 7/1/18, or can we work as an RSPMI until 12/31/18? No, RSPMIs have to flip by 7/1/18, or they will not be able to bill for any services. The RSPMIs shall flip by 6/30/18. The staff-to-client ratio in the partial hospitalization is 1:5. Does this mean that 5 are professional staff or licensed staff, or are paraprofessionals part of the 5 ratio? The staff-to-patient ratio is 1 staff person to 5 patients. Section 111.000 of the partial hospitalization licensure regulations state that the allowable staff are independently licensed clinicians, non-independently licensed clinicians, registered nurses, advanced practice nurses, and physicians. Paraprofessionals are not included in the 1:5 ratio. If you want to know what is billable and what's not billable, who has to be supervised and who does not have to be supervised in a BHA, may I suggest that you look at your outpatient behavioral health Medicaid manual, and under section 211.200 are the staff requirements. In there, it'll tell you what the provider type is, whether a license is required or not, whether a state certification is required, and whether that position requires supervision or not. Can you clarify who the staff report needs to be emailed or mailed to OMIG every month? The report may be emailed to medicaid.pi@arkansas.gov. And Medicaid, PI has to be all caps. So it's medicaid.pi@arkansas.gov. And that's G-O-V, spell out Arkansas. Will a provider with many sites have to have a Medicaid provider number for each site? Yes, each BHA site shall have their own Medicaid provider number in order for them to bill services. So you may no longer bill with one site with many satellite sites. You will no longer be able to do that. Each one of your sites that is going to be licensed and certified by our office has to have their own Medicaid provider number, with the exception of an ILP. If we become a new substance abuse provider, what will we need to do? If you are, and I think we talked about this just a little bit ago, if you are RSPMI and flip to BHA, you will need to check the substance abuse box below. We will then conduct a site review, and if approved, send you a substance abuse certification. We will send you the substance abuse certification standards and conduct an unannounced initial survey. You will then have 6 months to come into compliance with the regulations or have your temporary certification revoked. If you are in compliance, there is a one-time application fee of $1,500 for new applicants. And for those of you that are substance abuse providers already, you already know that there's a $75 yearly certification fee that will be required. Will I be able to bill for RSPMI after June 30th? No. How will you be able to bill starting July 1st? Our office will notify Beacon of your transition to OBHS, and I believe Craig touched base on this in his conversation with y'all earlier today. You will need to notify Beacon when your RSPMI treatment plans start and end, and indicate a start and stop date when your OBH treatments begin. Okay, I've got a couple of additional questions here that I wasn't able to get on the slide, but I'll go ahead and answer them now. Does the BHA need to have an office in each county, or does the 50-mile radius still apply? The 50-mile radius still applies. Are there alternatives to human resource records at each site? Does the full HR file need to be kept at any local site? I talked briefly about this earlier, that you can have a dummy file. We don't need to look at performance evaluations. However, we do need job descriptions, criminal record checks, reference checks, etc. Will it be okay to have Tier 1 services be given at home?
Yes, Tier 1 services are available at home by behavioral health agencies and by ILPs.
Thank you, Trish.
You're welcome.
So PLMSWs can no longer bill before testing as they currently can. That is correct.
PLMSWs may provide services as a qualified behavioral health practitioner until they are licensed, but they are not, under the current OBH regulations, considered mental health professionals, and they may not provide mental health professional services.
And that's because they only have a temporary license, correct? Where can I find the yearly benefits package with the allotted amounts listed? Where can the OBH manual be located? You may either contact me via email or Cindy Corbett via email or telephone number, and we can email it to you, or you can go to the Division of Behavioral Health's website and get it yourself. And I touched briefly on this again. Will the PLMSWs work at OBH agency be able to bill rehab level services? Will a mental health professional be able to bill the service and code child and youth support services?
So, like we said, PLMSWs, I can't talk today, can work in an OBH agency and be able to bill rehab level services as a QBHP, qualified behavioral health practitioner. And yes, if you are a mental health professional, then you supervise QBHPs, and therefore you can also provide any service that a QBHP can provide.
Here again, I recommend that if you have any questions or aren't sure, you pull out your OBHS Medicaid manual and look at section 211.200. Will Beacon be looking for client-family collaboration and signatures on those treatment plans to be completed to add OBHS services? Yes.
No.
No?
No.
Oh, I thought they were going to be looking for signatures on the treatment plan.
They're not.
Okay. Well, I stand
They're going to be
corrected.
looking for the signature of the mental health professional completing the treatment plan.
There we go. Thank you.
You're welcome.
Oh, now this is a yes. I would like to know about the IOCs, inspections of care. Are there going to be IOCs between July and December? Yes, Beacon will be reviewing your IOCs between July and December.
Trish, would you mind repeating on the treatment plan signature?
The treatment plan, they're going to be looking for the signature of the mental health professional who completed the treatment plan. That is the only signature they're going to be looking at on that treatment plan.
Okay, I'm going to finish the rest of my slides for you. For those of you who have not seen them before, and there's some slides that are going to come afterwards as well. Although the RSPMI will be grandfathered into OBHS, the provider will need to notify our office when they intend to flip to OBHS as a behavioral health agency. Once we are notified of the flip, we will send the provider their license and any special certification. Each provider site will have a license and/or certification with a unique vendor number, an identification number for our databases, listed on their license and certification. Here we go again. License will be good for 1 year until their CART certification review date. The expiration date will be listed on your license. Just want to say that what you'll see on there, you'll see a vendor number and you'll see a license number. Those are for our office, so when we come and complete site inspection surveys, we know what the address is and that the vendor number and site license number are site specific to the address. DIPSCO will then mail your provider license and or certification and send a copy of the license and certification and a copy of your transition form to Beacon and Division of Medical Services. Beacon and DMS will provide authorizations and review numbers to ensure billing can occur as smoothly as possible. To ensure a smooth transition, we are requesting those providers with multiple sites give us at least a 30-day written notice of their intent to flip. And as Craig stated earlier, we are going to start calling those providers, and there are several providers out there, and we are keeping a list of those providers who have not contacted us. We will be contacting those providers via email and letters next week, and starting Tuesday, calling them, emailing them, and writing letters and asking them when they're going to flip, and remind them that on June the 30th, that is the last day that they will be able to bill as an RSPMI. Please realize that if every provider waits until June, we will not be able to bill to process the applications in a timely manner, thereby delaying your ability to bill and delaying the authorization of services. ILPs. Independently licensed practitioners is an individual that is licensed to engage in private independent practice by the appropriate state board. The following licensure can qualify as an ILP: a licensed certified social worker, a licensed marital and family therapist, a licensed psychologist, a licensed psychological examiner independent, and a licensed professional counselor. Independently licensed practitioners may only provide Tier 1 services and shall not have mental health paraprofessionals. The expiration date is listed on your license. Oops, wrong button. And I have messed it up. There we go. Thank you. ILPs may have multiple sites. But each site shall fill out an application form and each site shall be certified. A site visit shall occur before each site is certified to ensure compliance with the certification manual. Each site shall have its own name, such as Proffer Counseling Services Little Rock or Proffer Counseling Services Hot Springs, etc. Sites may have more than one ILP in the office, but each ILP shall have their own office and space to provide private individual counseling. Each ILP shall have their own provider number, and each ILP shall have their own policies and procedures as outlined in the ILP certification manual. You can share, we don't care if you share your policies and procedures because it's easier to share than reinvent the wheel, but the policies and procedures shall have each individual ILP's name on it. And remember that ILPs are self-employed and work independently. However, you can contract with a BHA. All BHAs and their additional certification sites providing specialized services shall be licensed and certified separately, which means that if you're going to be a BHA and you're going to have a TC, that you will be licensed as a behavioral health agency and then certified as a therapeutic community. Remember, the provider with several BHAs may not bill under one provider number. Each site shall have a separate provider number. We're going to talk about substance abuse treatment programs. Substance abuse treatment services shall be provided only in a licensed substance abuse treatment program, and the services only be provided within their scope of service by a mental health professional. All BHAs and their additional, oops, I did it again. There we go. Each BHA and additional certification site shall comply with the licensure and certification regulations for each license and certification type. Behavioral health agencies and their specialty certifications shall comply with physical plant, staffing, and other requirements outlined in the licensure and certification manuals. The Medicaid manual, as well as any applicable city, state, county requirements, and as well as the Arkansas Fire Prevention Code. The most stringent of each requirement shall be maintained. Partial hospitalization. Providers requesting a partial hospitalization certification in addition to their behavioral health agency license shall not provide educational services at their site. I just want to clarify this. We are taking into consideration whether or not this is going to hold true. So we may allow those services, but we are still in the discussion stage. But we know that the BHA cannot be adjacent to a school. But we are looking at the partial hospitalization. I just want to tell you that right now. All RSPMI providers, just a little reminder here that you will notify our office of your intent to transfer, or tell us when you want to transfer would be even better, not the intent, because your intent is not truly the actual date. So if you, and it's getting so close now, but if you just tell us we're going to flip on this date, that'll be great. Providers give us at least 30 days notice. Now it's going to be 30 days for everybody. Providers, an individual applying for an ILP shall fill out the required transition form within 2 weeks of their intent to become an ILP. Both the behavioral health and the ILP shall send their notification by emailing Cindy Corbett at cynthia.corbett@dhs.arkansas, spell it arkansas.gov, or email to the Division of Provider Services and Quality Assurance, Post Office Box 8059, Slot S408, Little Rock, Arkansas 72203, or fax it to the attention of DPSQA, which is Division of Provider Services and Quality Assurance, Cindy Corbett at 501-682-8551. I keep saying that our website will have the form, but unfortunately we don't have the form on there yet. So if you email me or Cindy, then we can email the form to you to fill out. All BHAs and additional certified specialties units shall be in compliance with administration of medications, storage of medications, documentation of medication, and this includes scheduled narcotics, destruction of medication, and the results of PRN medications as required by the Arkansas State Board of Nursing, the Arkansas State Board Physician Statements as it relates to administration of medications, and the Department of Health Pharmacy Regulations and Requirements. In addition, all BHAs and ILPs shall have appropriate policies and procedures as outlined in the designated licensure and certification manuals. So, we will be looking at your medications. We'll be watching to see who administers medications. We will be surveying to make sure that your narcotics, if you have any, are documented appropriately, that the destruction of your medications are documented appropriately and sent to the appropriate place. Okay, all ILPs, BHAs, and their certified specialty units shall abide by their applicable requirements. Failure of the ILP, BHA, and certified specialty to follow the licensure, certification, and Medicaid manual shall result in a deficient practice. The provider shall receive a statement of deficiency identifying the deficient practice, and the provider shall provide our office or our designated representative with a plan of correction within the required time frame. Failure to provide an acceptable plan of correction or corrective action plan, as some folks know it, to the division within the required time frame shall result in additional remedies. The provider does have the option of disputing the SOD, which is a statement of deficiencies as required by law. Here's a copy of what the transition form looks like. You can see it's fill-in PDF format, name of site, Medicaid number, additional certifications if you want to have any. Check those and then just fill out the rest of the form. You may then email it to Cindy Corbett. Here's my email, my telephone number, Sherry Proffer, sherry.proffer@dhs.arkansas.gov, and my telephone number is 501-320-6192. And again, Cindy's number is Cindy Corbett, and it's cynthia.corbett@dhs.arkansas.gov, and her telephone number is 501-320-6415. Cindy, unfortunately, just gave her 2-week notice to us. She is moving on and to another job. We're sad that she is going to be gone, but next week we will tell you who the new contact person will be. I haven't made up my mind yet. So anyway, thank you again.
Thank you very much.
And talk to you next week.
Thank you, Sherry.
You're welcome.
I did want to mention, if you'd like for us to add that transition form to our website as well as the email that will be sent out to all attendees.
Oh, yes.
We would be happy to do that for you guys.
I need to do that.
So I will add that transition form to that email.
Thank you.
Just a reminder, if you do have any questions during the presentation, please submit them through the online Q&A section on your screen. And we're now going to be joined by Trish Gann, LCC Division of Aging and Behavioral Services, to discuss the transition plan and new services. So, Trish?
Yeah. Before I do that, I just wanted to go back. I think there's a question that came through, and it had to do with, will Beacon be looking for client-family collaboration and signatures on those treatment plans completed to add OBH services? The question is specific to, will Beacon be looking at them? No, Beacon's not going to be looking at that for signatures when you submit those treatment plans. That does not mean that you do not have to get family signatures. It just means that when you submit them, they're not going to be looking for them in order to look at that confirmation number. So there's no change to the OBH regulations in that respect. So first of all, I just want to I'm going to go through some of these slides relatively quickly. What we're doing is really making a transition now. We know that we are coming down to the wire. We have about 6 weeks left until we're going to transition from RSPMI to outpatient behavioral health. So from this point forward, these trainings are going to be around different sections and areas under the new OBH manual. We're going to be trying to answer all of your questions. We're going to go through our frequently asked questions and try to answer those questions around transition. So we're really kind of changing direction right now, and we're getting away from the idea that we're going to talk about independent assessment. We are moving toward transition at this point. If you have questions about independent assessment, you can email me, patricia.gann@dhs.arkansas.gov, or Stephen McKnight, and we will be happy to answer your questions in reference to independent assessment. So first of all, providers will be receiving a confirmation number for prorated benefits packages for the period of July 1 through 2018 through December 31, 2018. If you flip earlier, they're going to prorate that back too. So if you flip the 1st of June, they're going to give you 7 months. It's going to be prorated at 7 instead of 6 months. So let's talk a little bit about transition. I'm just going to kind of reiterate real quickly what Sherry said. I want to make sure that we're all coming at this from the same direction. So RSPMI providers will be grandfathered in, so there's been some questions about that. However, they have to notify DIPSQA as soon as possible of their intent, and as Sherry said, you really need to do that by or on June 1st to become an OBH provider and the date your organization plans to transition. If you plan to transition to OBH prior to July 1st, you're going to need to do the following. You need to notify DIPSQA of your intent to transition with a transition date. You need to notify Beacon of an intent to transition with your transition date, because Beacon at that point is going to, when you are transitioning, then we're going to end those RSPMI authorization numbers because you cannot bill under 2 programs at the same time. So when your site or your agency transitions, you're going to need to let Beacon know. Providers really need to have their confirmation numbers for their Tier 2 and Tier 3 beneficiaries before they switch. And then they need to ensure that treatment plans are completed on their Tier 2 or Tier 3 beneficiaries prior to providing services. If OMIG or on retrospective review look at those records, that treatment plan has to be in the record prior to provision of services. And remember that treatment plans are only required on Tier 2 and Tier 3 beneficiaries. They are not required on Tier 1 beneficiaries, so you can begin to provide services right away. So what's going to happen after the transition to OBH? So first of all beneficiaries who have not been assessed as a Tier 2 or Tier 3 will be able to access counseling level services. Any new beneficiary may access counseling level services when they walk in the door. Remember that they can get up to 3 services before a PCP referral is required. So those beneficiaries who want to can access Tier 1 services through a behavioral health agency, or they can access those services through an independently licensed practitioner in their own private practice or group practice. If beneficiaries continue in service and at some point it is determined that that beneficiary may require services contained in Tier 2 or Tier 3, the provider can then contact Beacon and a referral would be created for an independent assessment. If that's a behavioral health agency, then they will just submit that and they can continue to provide those services as a behavioral health agency. If an ILP decides that those services need to be, that individual needs to be referred, then they could refer them for an independent assessment. But once that client is assessed as a Tier 2 or Tier 3, then that client would have to be transferred to a behavioral health agency to provide Tier 2 and Tier 3 services. Optum will attempt to contact the beneficiary to schedule an independent assessment at that point in time. If contact is made and Optum completes the assessment, the tier determination is going to be sent to Beacon. Beacon is then going to notify the provider. A Tier 1 determination means that the beneficiary is not eligible for Tier 2 or Tier 3 services, and they'll let you know. If there is a Tier 2 or a Tier 3 determination, then a confirmation number is going to be sent to the provider based on that request, and beneficiaries will be attributed to a path, and Tier 2 and Tier 3 services can happen, and then care coordination is going to begin. If contact's not made or the beneficiary doesn't keep a scheduled appointment to complete the assessment, then that referral will be closed. Beacon will be notified of the closed referral. Beacon will notify the provider The beneficiary is not eligible for Tier 2 or Tier 3 services because there was no completion of that assessment, and then the provider can continue to provide counseling level services. So let's talk a little bit about Tier 1 services. Here is the Tier 1 service benefits package. Beginning when you switch from RSPMI to OBH, if that is prior to July 1st, then this package of services will be available to you. If you switch on July 1st, this package resets every July 1st. It is based on the fiscal year. So every July 1st, you're going to get this benefits package. Some of these services, the ones with a little house top, I don't know what that's called, those are encounter-based services. If you have any questions about time frames for encounter-based services, you'll need to look in your CPT code manual. The time frames under these, the 90832, 90834, 90837, 90791, 90792, those time frames for those services are all available in the CPT code manual, and Medicaid will follow the CPT code manual in terms of time frames for those services. For those services that are based on units, then please refer to the OBH manual. There is a chart in there. And then for those 60-minute units, in webinars that are coming up in the future, we're really going to define a little bit more. There's been lots of questions around 60-minute units and 30-minute units. So in future webinars, we're going to define the time frames for those 60-minute and 30-minute units. But this is just giving you an idea of the services. If you'll notice, there are some new services, and there are more services than actually were under the old benefits package. Psychoeducation is a new service. Group is actually a new service that was not under the benefits package before. Family counseling without the beneficiary of those collateral type services is now there. And also multifamily behavioral health counseling is a new service that is under the benefits package when you switch over and are providing Tier 1 services. Extension of benefits are allowed based on medical necessity for all Tier 1 services. The psychiatric assessment is allowed but not required. So you can provide services without a psychiatric, what is now under RSPMI, psychiatric diagnostic assessment, or then a psychiatric assessment. If that beneficiary does need to see a physician, then the psychiatric diagnostic assessment or psychiatric assessment can be completed, but only one may be completed per admission. So they're not required every year. You should only complete one, and then that one is good for the rest of the time that that client is in services. Benefits packages for some services benefits package for some services is cumulative across multiple codes. So, for example, the 12 encounters for individual therapy are spread out across the 3 individual therapy codes. So there are 3 encounters combined for 90832, the 30-minute, 90834, the 45-minute, and 90837, the hour. I just wanted to talk a little bit about the idea and talk a little bit about the transition or what is different and about the different thinking from RSPMI and really what RSPMI has been to the new OBH services. So I think these triangles kind of, we want this to represent kind of what we're looking at in terms of transition. So for children, the first slide actually has to do with children. And that is going to give you kind of a look at what services have really looked like for children under RSPMI. So the LMHP program, the Licensed Mental Health Practitioner program, School-Based Mental Health program, and the STATS program or Substance Abuse Treatment program, they're that tiny little block up at the top. So there's just not been a whole lot of those services that have been provided. Then your next block down is really your residential services. And those services, I may have these backwards. No, these are right. So anyway, so then you've got your residential services. And then down at the bottom, you have your RSPMI services. and that's kind of your outpatient services. So when you really start to think about the cost savings that are going to come from transition from RSPMI over to OBH, then really and truly the savings under this model are really savings that are at the residential and the residential kind of area. So that's really what we're talking about in terms of the savings goals. Those savings goals really are kind of looking at how services and how we can get savings through keeping people in outpatient services. The most expensive services that are provided to beneficiaries are those inpatient services, residential services, and those kinds of services. What is much more cost efficient and actually much better for beneficiaries is really for the majority of services to be at that counseling level. So the move forward is to really kind of step up and look at the provision of counseling level services. I know that there's been some concern about the idea that this benefits package at counseling level services only has 12 encounters of individual therapy. And I've heard a lot of people say, even before I came to work at DHS, that you only get one counseling service per month. That is just not true. What you get is 12 encounters of counseling service, and then once you have utilized those, or if you know that your beneficiary is going to need more than those services, then you certainly can go ahead and request an extension of benefits. So there's no requirement that you utilize every single encounter of services before you request additional services. You just need to make sure that when you are requesting an extension of benefits that you're really talking about why you're going to need those services. So for instance, if you had a child that came into care who had a lot of trauma type issues and you knew that you were going to provide some really intensive trauma-based kind of care, you certainly would go ahead and request the units or the services, encounters that you feel like you need clinically for that beneficiary in order to help them deal with those issues. The same thing would be around family therapy or any of the Tier 1 services. Extension of benefits is expected on some of those beneficiaries for sure, and providers are encouraged to request extensions of benefits on those beneficiaries in order to ensure that they're getting good care and that they're recovering. We don't want them to go into the higher levels of care or tiers. We want those services provided. If you had a beneficiary that was in acute care and you had concerns about them and they were suicidal, then you would certainly want to provide much more intensive services, those Tier 1 services on the front end, and request those services in order to keep that client out of the hospital or keep them from decompensating. And the next slide is pretty much the same thing, but more around behavioral health services for adults. So there is ASH has a lot of clients who are in ASH getting those more intensive kind of services, and as you all know, there's been really a backlog or difficult to get people into the Arkansas State Hospital. And then there's acute care and the psychiatric units, and then the RSPMI. And really what we're looking at is kind of equalizing that and moving over to the biggest part of this being at counseling level services or those outpatient level services, and increasing access across all of this through including ILPs and equalizing the rates under ILPs, including school-based mental health, which are providers. The school can be a provider, and they can hire therapists as the school and have those services provided in the schools. We really want to increase access and increase that base where people can come into care, the time frame in which people can come into care. We want them to be able to walk in and get services. There's been a lot of administrative burden on providers under RSPMI, where that person came in and there had to be a treatment plan that had to be completed and signed off on before you could start providing care. And then within 45 days, no matter who the client was, you had to provide a psychiatric diagnostic assessment. There are all these places under RSPMI where clients suddenly could come up against a wall and not be able to get services. And so the idea really and truly is to take those barriers away so that someone walking in the door can get the services they need and the amount and number of services they need on the front end without all of that administrative burden. So just wanted to kind of point that out to everybody, is that Tier 1 services are really designed for quick access. Tier 1 services are really designed to treat people at that level and hopefully for them to not get to the next levels of care. And Tier 1 services are really designed in order to create the least amount of administrative burden possible to providers. One of the things under RSPMI that has been an issue at some agencies where I've been is this idea that the beneficiary comes into care and they get a mental health evaluation and then maybe they don't come back for a while. Well, then you had to do a 90-day review before services could start again, or you had to discharge them and start all over again. And so under Tier 1, you're not going to have to do that anymore. That beneficiary can come in, let's say they get better, and then like 2 or 3 months later, they decide, ooh, maybe I need a checkup or I need to come back in. They walk back in the door and they get services again. You don't have to worry about creating those treatment plans. You don't have to worry about getting prior authorizations for those services. You don't have to worry about all of that. You just need to make sure, of course, that you have your PCP referrals. And in future webinars, we're really going to talk about assignment of PCPs because I know some people are really concerned about that. So hopefully next week we will be able to talk about PCP assignments and talking to your beneficiaries about that as well. But really our Tier 1 services are designed for really quick access to large provider network of providers, including individually licensed practitioners, school-based mental health providers, and behavioral health agencies, and quick, good access to services for our beneficiaries. And that's really all I have today.
All right. Thank you very much. So we are going to go ahead and start to take questions. I just want to remind you that if you do have questions, please submit them through the Q&A box on the right of your screen. And so the first question is regarding NPI numbers. Do we need to apply for and obtain new NPI numbers?
I don't think so. I mean, we can certainly go back and research that, but all mental health professionals several years ago were required to get NPI numbers. And so when I've gone from an agency to a different agency, that NPI number has transitioned with me because it's my NPI number.
Is there anything in particular that the letter of intent needs to say other than it's our intent to transition from RSPMI to OBH?
You need to fill out the transition form that we went over during the presentation. If you would like to have a copy of that, since we don't have it on our website yet, you can email Cindy Corbett at cynthia.corbett@dhs.arkansas.gov, or you can email me at sherry.proffer@dhs.arkansas.gov.
And just a reminder, you all will receive an email with a link to the presentation as well as the recording, and I will have a link to that transition form as well, just so that you can have it there too. Get to the next question. Can you clarify, is the SED-SMI certification required in the OBH program?
Woo-hoo! No. That's another of those administrative issues that we're getting rid of. SED and SMI certifications are no longer required. Clients' tier determinations and their independent assessment is all that is required.
When a provider flips to BHA, can they apply for substance certification at a later date?
Yes.
So speaking of services prior to July 1st, can providers still bill RSPMI services after they've transitioned to OBH, but can still bill RSPMI prior to that July 1st date?
So providers may bill for dates of service prior to 7/1/2018. and the timely filing timeframes apply to that. So I believe that's 365 days. So yes, that billing will be open under timely filing.
For counseling and rehab level services, do we bill Medicaid? Not Medicaid, I'm sorry. Do we bill Medicare for the services that are eligible?
Yes, you should always, Medicare is the primary provider, and then Medicaid is still secondary.
Will there be a different billing code for an MHP to bill a QBHP code or a different modifier?
No, they would just bill at that degreed rate.
Okay, going through some of my additional questions. Are LACs able to bill as an MHP?
They are able to bill as an MHP under a behavioral health agency. They are not eligible to be independently licensed as an ILT.
There was mention of not only notifying CMS of the intent to transition, but Beacon as well. Do we know who at Beacon they should be contacting? So we can find out that information.
Yes.
And I can even add it to this presentation before we send it out. If we can get that information, I'll just put a bullet underneath on that page. There's been a couple of questions about who to notify. We've received tier results, but no confirmation numbers. What steps should the providers take?
Can you repeat that question?
We've received tier results, but no confirmation numbers.
Yes, so we will cover that more in depth next time. If you have some specific questions, you can certainly email me about processes, but we're going to cover that confirmation process in much more detail in our next webinar on the 31st, correct, Sherry?
Yes.
Yeah.
Next week.
Next week.
Just to mention, we've had some questions about Beacon and the Beacon process, and I know that Beacon was here last week and visited on their process, and so you can go again to the AFMC website and look at the webinars and review that particular presentation, and it gives you kind of a detailed process.
And that presentation is also on the Beacon website under, when you go to for providers and then you go onto their website and look at those meetings, that presentation is there as well.
Going on down. Again, if you have questions, please submit them through the Q&A box. Can you confirm that Tier 1 will not cover continuation of care on a yearly basis as it is now with RSPMI?
I don't understand that question.
Tier 1 will not cover continuation of care. If you can clarify that question for us in the Q&A box, we'll be happy to come back to that question for you. In order to provide SA treatment, does the SA assessment service have to be utilized?
Yes. They would need to do a substance abuse assessment prior to providing substance abuse services.
And you may want to speak to this. I've had a couple of questions about benefit packages for Tier 2 and Tier 3 services, but it's my understanding that Tier 2 and Tier 3 will be
covered at our next webinar. We just think it's easier to kind of break it into segments and to answer those questions in segments so that there's not confusion between Tier 2 and Tier 3.
And Tier 1.
And Tier 1.
If you've already been approved as an OBH, do you need to contact Beacon to start billing July 1st?
If we've already licensed you as a BHA and any other additional certifications, Beacon should already have your transition paperwork and have been notified. So then you would also, I guess, if you haven't heard from them, you'll need to contact Beacon. And you may want to start with, just to give you a name, Melissa Ortega, and then she could direct you in the right, point you in the right direction.
So I'm going to go back to the dates of service prior to July for RSPMI and billing services. There's still some confusion.
So you may bill for RSPMI those services that are ended July 30th of 2018 back to June the 30th. Now wait a minute, let me get this straight. June the 30th, 2018 to June the 30th, 2017. Any services that you provide on July the 1st have to be as a BHA, and you have to be in the OBH system, transferred over. You will not be able to bill for RSPMI starting July the 1st. So you can, if you have not transitioned already and you are still an RSPMI provider, and you have not, you can still bill for those services that you provided up until June 30th after July the 1st.
Thank you.
Welcome.
Are PLMSWs able to bill OBH services?
We're going to answer that question again. Yes, PLMSWs are able to bill as a qualified behavioral health provider. PLMSWs may not bill professional services such as individual counseling, group, marital, and family counseling. They may only bill QBHP type, or what would have formerly been called mental health care professional type services.
Can LCSWs provide substance abuse counseling?
Can LCSWs provide substance abuse counseling? If their agency is a licensed substance abuse agency and it is within their scope of practice, then yes, they can provide substance abuse counseling under OBH.
Here's clarification of the Tier 1 continuation of care. In Tier 1, can you have an annual psychiatric continuation of care?
So in Tier 1, you're going to continue, like, when that client comes in, if you're talking about the psychiatric diagnostic assessment, there is no need for another psychiatric diagnostic assessment. It is not required in an annual psychiatric diagnostic assessment. It's not required. Clients can come in and out of services as long as their chart is opened, as long as it's an episode. They don't need to get that. They honestly don't need to get it. If the doctor's willing to kind of pick them back up on pharmacological management, they can pick them back up. So there's no annual requirement for a psychiatric diagnostic assessment if that's what's being asked at Tier 1. And you're more than welcome. If we need to discuss this and I'm not understanding, you can please give me a call at my office. It's 501-686-9431. If you're talking about a continuing care psychiatric diagnostic assessment, there is none because it is not required at Tier 1.
If we admit a client next week, will they still have to have a PDA even though we are less than 45 days to the OBH transition?
No. If it's less than 45 days, goodness gracious, it is, then no PDA would be required. However, if that beneficiary tiers at Tier 2 or Tier 3, then that beneficiary would need a psychiatric diagnostic assessment under OBH.
I'm going to go back to the billing for RSPMI and OBH one more time for clarification. Once you transition to OBH, even if before July 1st, you can no longer provide RSPMI services. Is that correct?
Read the question again, please.
Once you transition to OBH, even if it's before July the 1st, you can no longer provide RSPMI services.
Let me see if I can repeat that in the way that you asked it. If our office, if the Division of Provider Services and Quality Assurance has already licensed you as a BHA and you have maybe an additional certification, you shall bill as a BHA under OBH. Prior to your license, if you are an RSPMI, let's say, let me just give you an example. 5/1, you switched to a BHA. On 5/1, our office licensed you as a BHA. From 5/1 forward, you will bill as a BHA under OBH. On 4/30, prior to 4/30 and back, you may bill as an RSPMI if you were an RSPMI. So I hope that clarifies.
But let me just go further because I want to make sure that once you become an OBH, once your site transitions or once you transition as an agency to OBH, if that's before July 1st, you cannot change your mind and then decide you want to go back to RSPMI. Once you transition, you have transitioned.
Any services prior
To that.
to the transition
Yes.
could be billed as RSPMI.
Correct.
But after that transition, you are now OBH. Can Tier 1 services be provided at a home setting?
Yes.
Yes.
They said, thank you very much. That answers their question. All right. I'm going to take a few more questions. So if you have any pressing questions that haven't been answered, please enter them into the Q&A box. I know this has been answered on previous webinars about tier level and how providers will know what those tier levels are. Can you explain that process, and will providers know those tier levels?
So in the transition period between now and January 1st, yeah, I'm willing, like if you think a beneficiary's been assessed or you know they've been assessed and you don't know what that tier level is and you didn't receive it on your report because you get a weekly report, if you didn't receive it, any of us will be happy to assist you with finding those tier levels. If a new client comes in, you can certainly contact Beacon. You can contact any of us at DHS, and I can get you some additional phone numbers next time. We can do that on a limited basis. I can't do that on a list of 200 people, but on a limited basis, if you need to know that, that's fine. You can contact any one of us. after the switch to pass, all of that information will be available to the providers.
Is there still a 45-day requirement for psychiatric diagnostic assessment? This is for Tier 2 and Tier 3 clients, and we're going to discuss that during our next presentation or webinar next week, right?
Yes.
So we'll be able to answer those questions next week regarding Tier 2 and Tier 3. Earlier you mentioned prorated services for 7 months, 6 months, 8 months, etc. Can you explain that again?
I certainly can. If you decide on June 1st that your site or your agency is going to switch over to OBH, Outpatient Behavioral Health Services, and you're going to start providing those services, then when you request those services, they're going to give you a confirmation number that's going to be prorated. So we said we were going to give everybody 6 months of services, but if you start earlier, then you can request those services be prorated, and then you receive additional services in that confirmation number. I'm so used to saying prioritization.
For Tier 1 services, who confirms the diagnosis on those beneficiaries if no TPU is necessary and no PDA is needed?
On Tier 1 clients, if you're talking about your CARF or Joint Commission, and what you're asking is that there may be some kind of regulation under that where the doctor has to sign off on that. That has to do with your accreditation. But under OBH, the client comes in and receives a diagnostic evaluation or mental health evaluation by the professional. That professional diagnoses that client, which is within their scope of practice, and then they provide treatment. It's the same thing that happens every day under Blue Cross Blue Shield. It's the same thing that happens with private insurances all the time. Individually licensed practitioners can diagnose within agencies, then those would be your agency's policies as to how that's handled.
All right, that takes us to the end of our questions. There was another question regarding Tier 2, Tier 3 services, and I'm going to hold those questions until next week.
But we'll answer those FAQs next week.
Perfect. So you'll definitely want to join us next week, same time. And you'll get another invite regarding next week's webinar. So that takes us to the end of today's webinar. I want to thank Trish and Sherry for those presentations.
Well, thank you.
And I hope you all have a great weekend. Thank you.